What's up, everyone? This is Dr. Bartow, your host on Pill Talk Podcast. Pill Talk is your medicine, your daily dose to become inspired, motivated, and to live at your full potential. We have a good guest, special guest, registered nurse Amarachi, here with me today to speak to you guys about the nursing profession. She have a great career in working with sight patients, and we're gonna jump into it. How you doing today?
I'm doing good. How are you?
I'm good. I'm good. Happy you could come on and be a guest for Pill Talk Podcast today.
Thank you. And I'm excited to be here. And I'm just excited that you asked me to be a part of this. This is awesome. I've listened to some of your old podcasts. They were good. One of my best friends was on one of your last podcasts, Dr. Amaka Fadu. Check her out.
Hey, that's what it is. That's what it is. She was great on here too. So I know you about to do good since that's your friend. You about to turn it up.
Yes.
All right. So let's talk about you. What made you want to choose to become a nurse?
I kind of fell into nursing pretty much because originally I was on a different path. So nursing is my second degree. So I was originally going towards like the medical route to go to med school because in our Nigerian culture, it's doctor, engineering, nurse. And so I was like, I'll be a doctor because most everyone that's what they were doing. And then I was like, took the MCAT and was like, this is not for me. So my mom was like, well, go to nursing. So I kind of fell into it. And at first was like, I don't know if I could do this. But then after being in the hospital and really working alongside with other nurses, I like fell in love with nursing, and I truly do love what I do and the flexibility that it brings. So
That's dope.
yeah.
That's dope. So, what was the education? What did you have to do to become a nurse? Like the education level?
So the education for nursing is very different. So for me in particular, since I said this is my second degree, I went to a 4-year regular undergrad and got a bachelor's in science. So after I finished, I did a 16-month accelerated nursing program where I did what people do in 3 and 4 years in 16 months, which was nonstop, like tests every other week. And I got my nursing degree. And they even have some nursing programs that are 12 months, some that are 13, and you can get them very fast, but it's like hard paced work the whole time. Or you can do the just regular traditional route, which is like 3-4 years of nursing school as your undergrad, just regular 4-year college. But I did mine in 16 months and it was rough, but we made it.
Yeah, I can imagine that.
Yeah.
Um, what made you choose that program, the 16-month program?
Well, since I already finished my degree, I know I didn't want to go back for a longer program. And I decided to go to nursing school like 3 weeks after I graduated school. I was like, okay, well, I'm going to go to nursing school now. So I wanted something that was quick. I felt like I had enough stability and perseverance in my own life that I could push through a program that's quick, even if it took a lot. During that program, it was very much focus, didn't have much social time because you had to get through it. We literally had a test every other week during that program. So I just knew that the quicker I finish, the quicker I can get into getting into my career. So for me, that was the best thing that I could do for my life at that point. So that's why I chose a faster rate.
I'm not mad at that. So how was the clinicals like with that 16-month program?
So we started doing clinicals second semester. We started doing clinicals. And even part of our first semester, towards the end of our first semester, which was, each program was like 8 weeks long. Each semester was 8 weeks long. We did clinicals towards the end, and it was, you do your classwork, go to clinicals, do your class, go to clinicals. We had clinicals every week because you had to, what people would get in a longer span we're getting it in the shorter span. So you have to go to clinicals. We're having clinicals every week. So you're staying up, you're going to clinicals, working your 12-hour shifts for free.
Yeah.
And then you turn around, you still got to study, you make sure you pass the test that's going to happen on Friday. Because, with nursing school, most nursing schools have a curve. So they'll say if you get a grade below 74%, that's failing. If you fail 2 classes, you're out.
Yeah.
Pretty much. So, you have to keep making sure you meet above that curve in every class, as well as my nursing school was like 74 in a class overall and 74 on an exam. If it's not higher than that, you fail.
The bare minimum was a 74. Damn.
Yeah. And that's a good, because there's nursing schools out there that's like 80%. Oh, yeah. If you don't have above an 80, So look, take the small blessings. That's what I did.
Yeah, I can imagine that, yo. Because pharmacy school was hard and like continuous, but 16 months, I couldn't imagine. Like, I would believe you literally went to school during the day, clinicals at night, no sleep.
Okay, look, sleep, I don't know. I ate food. I know that. I know that. But I mean, it was an experience that I would not put myself through again, but it was worth it. I love what I'm doing now, and I'm so fortunate to have the job that I have now and the job that I did have prior to this. So look, that 16-month nursing degree was worth it to me.
What's up, everybody? Let me introduce myself. My name is Dr. Bartow. I'm a pharmacist that was featured in one of the most prestigious publications, Marquis Who's Who, in 2021 as a top medical professional of the world because of my impact through medication therapy management, outreach programs, and networking. I started my own podcast, Pill Talk Podcast, to sit down and talk with other top medical professionals about their journey. Some of the topics that we cover in our conversations are their career path choice, education level needed to practice in their career field, and most importantly, how they're impacting the lives of the patients that they see daily. So, I would like for you to join me every Monday at 6 p.m. as I release new episodes so you can learn about the different medical fields from the top professionals themselves. I just want to let you know that Pill Talk Podcast is just not a podcast, it's your medicine. The daily dose you need to educate, motivate, and aspire to live at your full potential. So become an empowered leader and start to dream bigger with Pill Talk Podcast. So, I want you to go ahead and subscribe to my YouTube channel and support the podcast by becoming an active listener and purchasing some merchandise. Thank you. Yeah, I can imagine. And going into the next subject, speaking about your career, your jobs. So let's talk about your first one, because you said you started off in the emergency department, right?
Yeah. So I started off in the emergency department as a new grad nurse in a level 1 trauma center. And then in this level 1 trauma center, we also had the ability to not only work with trauma patients, but we also worked with psychiatric patients, pediatric, and of course our adult population. So we would basically rotate every few shifts. You would be in a different area. So you had to be competent with basically all ages and all kinds of things. And it was a wonderful experience. It was intense. But it was worth it. And I learned a lot. And now, though, I only work with psychiatric patients in a behavioral health ER, which is still under the same health company that I work for now. But basically what the ER really taught me was, you never know what comes in the ER. You from a cardiac patient to abdominal pain, altered mental status, like there's so many things to a psych patient. And what the ER showed me is where my passion really lied and what I really love. So prior to going to nursing school, I always had a passion for mental health and just the psychiatric population and behavioral health population. But I didn't want to go right away. I wanted to make sure that that is what I love and see what's out there to just make sure I don't have a passion in something else too. Like maybe I like mom and babies, maybe like only peds, maybe I like bones more. So being in the ER gave me that flexibility to learn about everything and see everything. And then that's when I really knew like, okay, no, I really do love psych patients. I really love behavioral health and mental health. So I moved over to that and I solely work with that population base right now.
That's dope.
So,
That's dope.
yeah.
But you did say one great thing in there. By working in the emergency department, you got to touch all the like demographics, all the different aspects of nursing, and was able to find the one that was right for you or the one that you connected with the most. And now you really into that. Did you have to do any extra training once you got to this point, or once you decided you wanted to do the psych patients?
No, because since in the ER that I was working, I have gotten every single training you possibly can get since I worked with all. So it was just a smooth transition. It was like to this. So it's great. So now it's just like if I want to get extra certificates outside of that for the behavioral health population, which is what I'm working on to get now. But yeah, it's amazing. I do this and I have another job too. And that's the beauty of nursing. You can have like low-key like 3 nursing jobs at one time. You got a full-time, a part-time, a PRN. Look, it's great.
You on the grind for sure, for sure.
But gotta make money somehow. But yeah, I'm also an IV hydration nurse. So what that is basically like medical spas. Medical spas are new things that are up and coming. And so basically the best way to describe it, how people get hungover and they wanted to go get a drip.
Yeah. Sound like the
So
movie
like you
Hangover.
see it on TV. Yeah, you see it on TV, but yeah, we don't only do hangovers. We do a bunch of other things as well. But that's basically what I do. I give IV drips to people and like B12 shots and stuff like that. So it's fun. It's a nice job, different pace from the ER. Yeah. It's like one job is like, go, 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 go. The other job is like, let's chill, like, like vibe. So it's nice.
All right. So let's jump into that one, like the IV drip, the hydration.
Yeah, hydration.
So what kind of things do you just said you give banana bags. So for people who got hangovers, you give B12 shots. What else do you guys do there?
We also can do, basically drips are tailored for the need, right? So say if someone came in and said, I have a cold, I've been feeling under the weather, we can do we'll call it hydrate wellness drip, which that will contain like vitamin C. It will contain zinc. Some drips contain taurine, carotene, like those different vitamins and minerals that we can put in that. I mean, you can go to and take, like if people take vitamin C daily, you can get them in a drip. We have drips that are tailored towards beauty, and we give glutathione, which the best way I describe it when I'm describing it, it's like an amino acid that sticks to your free radicals. In layman terms, it's like a detox. And we do drips towards hydrate athlete. We do drips for muscle recovery for athletes. Of course, the 2 hangover drips. We also give oxygen therapy. And what oxygen therapy helps is like it can help with migraines, like headaches, and like just kind of clears your mind. We have lots of different options. And we also do NAD plus. Drips. So NAD plus, it helps with there's 2 different ways you can do NAD plus. So there's anti-aging, and it can help with anti-aging, or you can do, there's an NAD plus that is tailored towards like PTSD, depression, and it can help with acute suicidality. So it's cool.
Oh, dope.
So, we also do ketamine drips. So at my specific clinic, we don't, but like they also do ketamine drips, and ketamine also helps with depression and PTSD. The NAD plus can also help with substance abuse as well. So more like chronic alcohol users. And if you're trying to wean down and try to even get to 0 drinks. So say you start with 10 and you try to get down to 0, that helps as well. So
Okay.
yeah, we have lots of different options of drips you can do. I think when people hear about IV hydration, they automatically think hangover, like, which is what's popular, right? That's what a lot of people do. But no, there's a lot of different benefits you can do, even for like pregnant women. If if they're just dehydrated, you can just give a basic liter of fluids and some Zofran, which if you go to the ER to get that, it'll be like extensive amount of money just to go to the ER. But there, you won't have the long wait time and it won't be as expensive.
That's one thing I was just about to ask too. Like, does insurance cover the hydration drips, or does people just have to pay out of their pocket for this?
You got to pay out of pocket, but it's worth it.
It's worth it, definitely.
It's worth it. Yeah.
Definitely. Man, I think the first time I came across that was in Vegas, because somebody was like, "Hey, man, multiple things, but for what they was using it for was like getting themselves back to 100% after like drinking all night. Like, listen, we about to do it again. The bus is coming to pick me up." I'm like, "What bus?" We're like, "What are you talking about?" They're like, "You don't know? We about to get an IV, ride around, get back hydrated, and then we coming back and doing it again."
I mean, it's nice. I've gotten them. They're good. I like them. So, I mean, not everyone likes to get IVs, but if you do and you don't mind it, it's a good thing. So.
What's up, everybody? Let me introduce myself. My name is Dr. Bartow, and I'm a pharmacist. Being a black healthcare provider is a gift, and I'm going to tell you why. Because when patients come into the pharmacy, they're able to see someone that looks just like them, and they're able to let their guards down and really open up so that I can provide the best customer service to them and healthcare service as well. And let me explain why I say this. A gentleman came into the pharmacy to pick up some meds after being hospitalized with COVID. His ED doctor gave him the meds but didn't instruct him on how to properly use the inhaler, the reasons for the steroids, or the common side effects that he's going to face on his road to recovery with COVID. When the patient saw me, he stopped and pulled me to the side and asked, "Can I go over the meds with him?" I sat down and took the time with him to explain the disease state, what to expect on his road to recovery, coach and demonstrated how to properly use his inhaler, and go over the highlights of his steroids. When he came back to the pharmacy after he got back to his normal routine, which took about a week or so, he came in just to tell me thank you. Because unlike all the other doctors he visited, no one wanted to take the time to explain to him or even make him feel comfortable to ask questions about the medication or the disease state that he was facing. And that is the reason why representation matters in the medical field. Because when he saw me, I was able to connect with him on a different level. I was able to break down the information in a way that was ideal for him to receive the message. And making an impact in our patient lives is key. And that's why we need more black healthcare providers in the medical field. So join me each and every Monday as I release new episodes so you can learn about the different medical fields from the top medical professionals themselves. Because Pill Talk is not just a regular podcast. Pill Talk Podcast is your medicine, the daily dose you need to educate, motivate, and inspire to live at your full potential. So, become an empowered leader and start to dream bigger with Pill Talk Podcast. And while I got your attention, make sure you go to my YouTube channel and subscribe. And
it's a new age.
So, what made you get into that one? Or get into that?
I always thought medical spas were really cool. Just like seeing them on TV, you see it. So it was really just random. Like I was like, looks like a different pace from what I'm doing now. And I feel like one big thing for me in working in that medical spa was like most people who utilize medical spas and these type of things are usually a certain population or ethnicity, right? And I feel like a lot of people don't know that things like this are accessible to all types of people, right? So for me, I just want to normalize a sort of I feel like when people look at medical spas, they think it's just like luxury type thing.
Mhm.
But I mean, you can look at it like that, but I just wanted to normalize luxury for all ethnicities and all people, and say like this, like medical spas, getting these drips, we offer Botox as well. I didn't mention that, but getting stuff like that, it's everyone and anyone can do it, you know? And I think more of us or African American people who work in that type of field lets other people be drawn to it and want to be like, okay, like I can work in something like this, or I can go and get something like this and it's okay. Like I feel like you don't see enough representation in certain areas. People feel like it may not be for them, and that's not the case. Does that make sense?
I was just about to ask you that, because how you were saying it, breaking it down, you was like touching the real surface level, but I'm gonna jump right into it though. Representation matters. So when people coming in and see you, they probably be like, okay, we in there. All right.
Yeah.
Do they feel more comfortable dealing with you, or do they feel more comfortable with just in general being in there, knowing that this is something that is able to be touched by all people?
Yeah, I will say so, that they do. And like, for example, we have a drip that is called a beauty drip. And like I said, we give the high dose glutathione, and the way that it was like high dose glutathione can help with skin lightening. When you say skin lightening, you don't want to say like, people might not understand when you say skin line, like it's gonna light my skin, but no, like it can also help with hyperpigmentation. And that's something I got to teach the staff, like, okay, hyperpigmentation, like, you know, African Americans, a lot of us suffer with hyperpigmentation, and this can help. And being able to get to talk about that and market that to the like different patient population that came in, who maybe have came in before but didn't understand that or know that, and seeing me there and knowing like, okay, this woman, she'll understand. I think it's a sense of like security and safeness when you see someone that looks like you and who's going to take care of you. Does that make sense?
No, it makes perfect sense. I got an example for it, but it makes perfect sense. I had a person come to the pharmacy, and when they saw me, he was just like, "Can I speak to you for a second?" I'm like, "What's up?" He was like, "Yo, I don't know what none of my medications for. None of my doctors told me anything. Like, can you help me with this?" And he was just like, I went down and broke everything down. And he came back like a week later. And he was like, I don't want to say thank you. Like, I went to the hospital, went to my own primary care. Nobody looked like me. Nobody wanted to take the time to answer my questions. They just kind of like rushed me through. And when I saw you, you kind of like, we kind of connected. Or his words, like, yo, like when I saw you, like, yo, I knew you was good people, man. Like, I knew you was going to look out for me, brother.
Yeah, that's
like,
real. I mean, because it's like that sometimes. Like, even if we even transition this conversation back to the mental health, a lot of the patient population that I see that struggle with mental health is usually African American, right? But the way it's displayed sometimes in, for example, African American men can be aggression or like upset, they're angry. And other people may see that as a threat, but then you have to think of what this person may have went through, and they're not physically trying to be aggressive or verbally aggressive towards you. They're just frustrated, and that's how they get out their anger. And in mental health, sometimes in the behavioral health, seeing someone that looks like you, especially in that area, and that can talk to you like a person, though you're struggling with something mentally, but can break down things to you that you understand and sees you as a human being, even though you might be struggling with hearing voices or seeing things that aren't there, and being able to sit there with someone that looks like you and you're like, hey, I might not understand what you're going through, but I'm sitting here trying to talk to you, and I want you to feel comfortable. I want this to be a safe space, and I want you to be able to share with me. If you're frustrated, I understand that, you know, you can come back and talk to them, but just being a person where they don't feel like they're getting judged for how they're behaving or how they're acting, it goes a long way. Like, when we have psych patients who come in of certain ethnicities, automatically, I feel like some people get on edge or get nervous because they don't know how this person's gonna act. But when they see someone that looks like when these patients come in, you're like, hey, look, I know you're upset and I know you're angry, but I need you to bring it down. And we're able to talk to each other like that, you know? And they're like, okay, well, this is what's going on with me. I didn't feel comfortable telling that person, like, this is what I've been struggling with, but I'm telling you what I'm struggling with. And I'm able to go and relay that to the team. I don't know, it just feels good. And it's a good thing. So I think representation and being there for these patients, especially in the psych world, and most of them being African American over here, I love it. I think I talked in circles, but yeah.
Nah, you hit a couple of good points. One is feeling comfortable. So like speaking with someone in their language. Like when you see someone, it's like an automatic connection. Like, okay, when I say something, you know how some people want to express themselves, like, but they can't really figure out the words, but you understand the culture. So it's just like, all right, I know what you're trying to say. All right, this is what you're trying to say, and this is what you mean, right? And that like helps break everything down a little easier. But yeah, just being able to like speak with someone on their language, their terms, and having them to understand you, because that's where a lot of patients come in at, and it was like, yo, I couldn't open up, I couldn't really express what was really going on with me because they couldn't understand what I was saying, and then you're like, but you
Or how I
understand
was
me.
saying it. Mm-hmm. Either understand what you're saying or how you're saying it, because in certain fields, especially in nursing, I feel like we can't take a lot of things patients say personal, you know, in healthcare in general, because you're meeting patients at their most lowest moment sometimes. Like they feel horrible, they're in pain, sick. Of course, most of the time what's gonna come out of their mouth is not that nice. But I mean, in knowing that, we know that that's where that compassion and empathy comes in to play. Because if I was in their shoes, I'm probably upset too. You know, this is the lowest moment that I have. So learning to like make people feel okay to say what they want to say, how they say it. Now there is a disrespect line. I'm not saying that there's not a disrespect line, but you know, like sometimes the way people say things, understanding it in a point where, okay, I know you're upset and how you said it, but I'm still here for you, you know, because when you don't give them a reaction and you're kind, they tend to be more responsive and comfortable around us. So.
Yeah. That's dope. That's dope. Because things like that happen. People come to the pharmacy upset, and I sit down and talk with them, and they were like, when they get home after they done curse me out, yell at me, they call back and be like, I don't want to let you know I've been upset. I apologize how I came off. I appreciate you. Now let's not have that happen again. But
Okay.
but have a good day. Um, so as a nurse, being a full-time nurse in a psych ward and working at the hydration or medical spa, how do you find time to have a work-life balance?
You know, I think I do pretty well with my work-life balance. I do work a lot, but I try to either pre-plan things ahead of time, or sometimes I do spontaneous things. Especially like I have work 2 jobs and I'm in a relationship. So like just balancing it all and making sure that I just devote time. I'm type A a bit, so I plan everything out. So, but every now and then do spontaneous things, because I mean, if you're work all day and don't take time for self-care and in working in mental health, I prioritize self-care a lot. Like if I can't do it, or if I feel overwhelmed, then I'm like, look, I need to do life right now and not do work. Then, I mean, you can call out. Not encouraging people to call out. But look, prepare the others, because look, we're going to take that PTO and we're going to live our life. Because how can you serve, especially in healthcare, how can you serve a community and try to pour into others when there's nothing being poured into you? So you're basically pouring from an empty cup. There's no way you can be able to help other people. And then that's when people start getting work fatigue. They start losing compassion. They start getting into nurse burnout. And nurse burnout is a big thing that's going on right now, with nurses working so much that they're forgetting to care for themselves. So look, self-care for me is momental. Even when I get back from work, I still, like after a 12-hour shift, I'll come home and still watch a movie, or I'll do some meditation, or I'll do something that still grounds me, even if I work a 5-day in a week. Well, after work, if I don't have off days where I can do anything after work, before I go to bed, I will make sure that I get back to being grounded and practicing some type of self-care. Like especially journaling is something I do, and I encourage a lot of people to do. Journaling really releases your mind, and you can talk about your work day and let it out there. But I might not be someone that always may go out and like party or do all stuff like that. But for me, even staying at home and grounding myself is enough balance for me. Does that make sense?
Yeah, that
So,
makes sense.
yeah.
All right. I think my last question for you. All right. You do a lot. You've done a lot so far in your career. But 5 years from now, what's your next goal? Like, what are you aiming for down the line?
5 years from now, I plan on hopefully having a doctorate in nurse practitioner of mental health psych. I plan on hopefully, working in an outpatient/inpatient setting, working on getting my own clinic, because I do want a mental health outpatient clinic that serves a mix of underserved community and people that look like me, so they feel like they can come and have someone to talk to. And that will really, I feel like a lot of people don't like to go to therapy and get help, and having a clinic ran by someone that looks like you will normalize people going to get therapy even more, because I'm so here for therapy. And being able to have that practitioner license, I'll be able to prescribe medication as well. So I want a clinic that's called Behind the Smile. I already got the name. But I want a clinic in the future, a mental health clinic. So that's really my 5-year and beyond goal, is to have that.
That's dope. That's dope. I hope you get it. I hope you get it before the 5 years.
Yeah, I hope so, man. I hope so. It's a goal. We're going to get there. Behind the Smile is a name that I've been using since college for anything that I've ever done for mental health. I used to make mental health videos, like educational videos, people sharing their stories of what they've been through. And, I hope it's something that carries on for a long time.
Hey, go ahead and trademark that right now. Just go ahead.
Yeah, nobody take it. Look, y'all better keep that to you. Nobody take it. But yeah, I appreciate this though. I appreciate you and I appreciate this opportunity.
Oh, no problem. I was just about to say thank you for coming on Pill Talk Podcast. We appreciate you. Let everybody know how they can get in contact you. With you, if you got a website, Instagram, Facebook, so that people want to get in contact with you, talk about, mental health or nursing, whatever, they can get up with you.
Yeah, so I don't use Facebook, so you can't find me on there. I do have an Instagram and it's at Jasmine, JasmineOkafor, Jasmine Okafor. I don't have a website yet, coming soon. Stay tuned. But that's pretty much the main way to reach me is Instagram, because I don't really use no other socials.
So we got you. We got you. So I appreciate you. Thank you for coming on. Hopefully we will see you on another episode of Pill Talk soon.
Yeah. Thank you.
All right, you're welcome.